Hi, everyone. Thank you so much for coming to today's Health Data and Innovators info session. I'm so excited that we are launching this new program. I'm even more excited to be partnering with incredible Stephanie, who has just been a great counterpart to be working with this, and she is going to be the lead instructor. And so I am going to introduce her and then kind to let you know that this is being recorded, so we can send this out if you miss anything. I am going to step away for a bit for another meeting, but I will come back toward the end of the meeting. If not, feel free to send me an email or a phone number or call me on my office phone, and I will be happy to answer any questions. I will be sending out emails to anyone that I still may be needing the registration form to officially register you for the class. But I'm looking forward to having you join us for our January start date for this new program. So without further ado, I will hand it over to Stephanie, and you guys are in incredible hands. So Stephanie?
Great. Thanks, Devonna. And do you want to share your contact info just in case, or does everybody
sure
have?
will. So I'm going to say it out because we're recording, but I also will include it in chat. My email address is djames42. So D is in Devonna or dog, James, James, 42 at cnm.edu. And my office phone number is 505-224-4000, extension 53637. Again, 505-224-4000, extension 53637. And I will also drop that in the chat.
Awesome. Great. Thanks. All right. Well, everybody, I'm going to go through a quick presentation, just a high-level overview of the program. We'll dig a little bit more deeply into the curriculum pieces because I know that a lot of folks had some questions around that. And then I do want to leave some ample time for Q&A at the end. Again, we are recording this session for folks who couldn't be here, and everyone has different levels of engagement and background on the program. So hopefully we can provide an overview for everybody. And if we don't, just pop your questions in the chat. We'll try to get to them at the end. And then, like I said, we'll have some time to talk about them as well. All right, so Health Data Innovators, 9-week part-time virtual boot camp. Today, I want to talk a little bit about what the boot camp is, who it's for, who it's best suited for. You can decide if it's a good fit for you. We're going to take a little bit of a deep dive on the curriculum and get into some of the specifics there. I want to talk a little bit about what kind of careers and what kind of trajectories that the boot camp is designed to prepare folks for, as well as how to apply and some of the next steps like internship and job placement, as well as some of the certification exam that the program will prepare folks for. All right, so why did we launch this boot camp? Healthcare, in a nutshell, is changing. I've been working in healthcare data and technology for the last 15 years, and what we're seeing is just a big digital transformation. We're seeing a lot of moves to digital health. We're seeing a lot of health technology startups come up and crop up in the space. We're seeing a lot of folks who have an interest in how to use data and technology to innovate in the space. And so we launched this boot camp to really bridge the gap between technologists and folks who have an interest in future innovation and transformation of healthcare, and maybe who have even a basic understanding of healthcare, have been working in the field for a while, but really want to get more into the future focus types of fields that are really going to be leveraging a lot more digital health technology, data integrations, data science, and all of that kind of stuff. So that's really what our focus is. It's a little bit different from your traditional health IT type of curriculum. So health IT, very important, has been around for a very long time, and that focuses on things like medical coding and systems, installing and electronic health records and all of that kind of good stuff. Very important and foundational to what we're doing here. But what we're going to be really talking about in our program is how do we use all that information and take it to the next level for things like population health management, digital health equity, digital health applications and interventions, and all of that fun stuff, which we'll get a little bit more into. But that's pretty much the gist of the program. And New Mexico is really undergoing a change itself. So as many of you know, New Mexico, we don't have the best outcomes. We rank, in the bottom 10th for a lot of health outcomes specifically. And in our minds at Health Inno, one of the reasons we wanted to launch this is because we do believe that technology has a very big part to play in helping to improve healthcare in New Mexico. Obviously, there's other factors, but we really want to prepare the next generation of leaders to think about how that might look. So, who is this program best suited for? So we kind of designed it a little bit broadly, but I'd say there's probably two major categories of folks. There's the folks who have maybe a technology background. So these could be graduates from a deep dive boot camp, the data science boot camp, or software application developers. They could be folks who've been working in technology for many, many years, and they're either interested in healthcare or they're really wanting to pursue a next level career in healthcare. But the challenge for folks who've been working in technology for a long time but haven't been working in healthcare is that it's very hard to break into the field because there's a lot of very industry specific, very niche knowledge that a lot of times means you won't even make it past an interview because you don't speak that lingo, or you're not, you don't have an example use case under your belt of what they're looking for. So our goal is to really equip technologists with the healthcare and health administration specific knowledge needed to break into the field and to thrive. And then on the other hand, while it says clinicians, really this is anyone who's kind of been working in the healthcare or maybe a healthcare ancillary type of a space, public health, for instance, we've talked about, who have a general understanding of healthcare broadly, and maybe even a general understanding of data and technology and things like that, but really want to focus it on, again, these next level careers that are very specifically in the areas that I talked about: digital health, innovation, health, data and analytics in the healthcare domain, which I do distinguish from our public health domains and our public health colleagues. Healthcare for us, and the types of careers we're focused on here, these are the ones that are working for like the Blue Cross Blue Shields of the world, the Presbyterian Healthcare Services of the world. Folks who are really delivering healthcare and actively involved in what I would call the healthcare ecosystem, of which public health is a part, but public health tends to be a little bit more community focused and a little bit more broad based. So we are focusing on some of the nuances of like the business of healthcare and how that fits into the ecosystem. And then really just career changers who are interested in wanting to specialize in this area. They might be interested in health technology startups, or maybe even becoming a founder. They want to understand what the ecosystem looks like, or maybe they want to work for an organization like that, or maybe they want to get into one of these organizations that I just mentioned. So no prior healthcare experience is required. It is, we're keeping it very entry level. We are going to cover a lot in 9 weeks. It'll be very intensive, but you'll get a really good, well-rounded overview. We do ask, though, that you do have some comfort with data. That could be working with like Excel, spreadsheets, databases, things like that. You don't have to be an expert. I'd say if you're comfortable with like Excel level pivot tables and things like that, that's probably okay. More is always going to be better in these cases for these types of data technology programs, but we'll talk about it. Some comfort and familiarity with using new software tools. I'm using that very broadly, but some of our partners are going to be bringing in some tools to use to get you some hands-on experience with things. They'll walk you through how to use it and how to work with some of their APIs and do some of that stuff. But just a familiarity and comfort with technology and using new software tools would be really good. But again, we'll be building the knowledge together, and this program will have a lot of mentorship and one-on-one opportunities for learning. So if someone requires or wants a little bit more hands-on and one-on-one time with one of us, that's going to be okay as well. All right, so here's just kind of a quick overview of the program. I mentioned it's 9 weeks. It's twice a week. It's on Mondays and Thursdays. I believe it's from 3 to 5:30 Mountain Time. That's a total of 18 sessions and 45 hours of instructor time. It's fully virtual. It'll be on Zoom. We will have some opportunities for some in-person mentorship and working together if folks want. Again, we'll have some one-on-one office hour time and stuff like that. And so we're not limited to this, but while these are the teaching hours and the teaching times, there will be some offline work and time that the students will want to probably put in as well, again, because we are going to be covering so much in a short amount of time. But the program does start officially on January 6th or January 26th, with a deadline to apply and get everything set up by January 16th for registration, and it runs through March 27th. of 2026, Monday and Thursday, as I mentioned, from 3 to 5:30 Mountain. We have some flexibility on that time. If it depends on everyone who registers, and we can, just make sure that we're picking times and dates that meet the majority of folks' availability. So if that is something that's flagging to you, let's talk about it. Again, format 100% virtual, so to ask that folks are just comfortable, using Zoom and interacting and engaging in online format. And we do have not investment, but funding, grant funded for learners. So the program does prioritize New Mexico learners, folks who live, work, or want to expand and work into New Mexico. So there is funding available through CNM for scholarship for the program for New Mexicans. All right, making good time here. We've got about 10 more minutes of this, and then I want to get into our Q&A. All right, so this is the question I think that most folks had questions about, and that was probably pretty light on some of the marketing. So I just want to walk through this in a little bit more detail. And again, we'll have time for Q&A at the end. I'll caveat, I might be reorganizing the flow of the week by week play, but the content will stay the same. So we are going to start with an overview of the U.S. health system and kind of the health IT landscape. The goal of this is really to understand the broader ecosystem and how all of the data plays and interacts with each other, as well as business incentives and alignment. This gives you a really good overview of the business of healthcare, as well as how the data and the technology flow, starting at the very highest level, like CMS, ONC. These are very like national regulatory bodies. Policies and things that trickle all the way down to Medicaid, managed care, how that flows through to healthcare providers, out into the patients, how the data flows, how the money flows. We're going to really dissect all of that with the goal of the learners understanding what kind of data you're looking at different points in time and how it all comes together, and how the reimbursement and incentives align with all of that, because all of that is very core and fundamental to not only doing analysis in this space, but also working and selling products in this space, and also implementing new tools and technology with a business case in this space. And so we start by laying that groundwork. And then we're going to get a little bit more hands-on. Again, I think I might change the order of this, but at some point in time, we are going to actually dig deep into that data. We're going to start with very common electronic medical record, electronic health record type data that uses what we call standards, HL7, FHIR. We'll talk about what all those mean and where they've come from. But these are industry-wide standards for data integration, data extraction, content, and you'll understand how these data standards work, how they're segmented, what the data looks like, how to get in there and use APIs to extract and integrate data together. We're going to have some partners who have been working in the informatics space come and teach this part. There's a live learning lab where we're actually going to be like working with example pieces of data, synthetic, of course, and de-identified, but so that you can actually get experience using these data standards to extract, transform, and integrate data together. So that's what all week 2 and week 3 is talking about here. Kind of call it like messaging or data standards, and interoperability is kind of what that section is. We have actually 3 full weeks on that. Again, we'll kind of think about what the ordering of that is going to be. But then we're also going to be talking about in this first half, kind of aligned with what I was talking about with week 1, the economics and the business side of this. So we're really getting a 2-prong approach here. And I think this is really important in this space, because you have to understand more than the technology to do really good work in this field. And so not only are we going to be getting our hands dirty with some of the data, and we're going to learn about the landscape of the healthcare system, but we're also going to dig deeper into some of the things that I alluded to in week 1, which is I call healthcare economics, or maybe payment models. This is reimbursed. You may hear it by reimbursement. Again, this goes beyond how the money flows and to whom. This really goes into all of the different payment models and all of the different provider incentives and all of the different value-based care and healthcare programs that exist out there. Maybe not all of them, but the most important ones. How codes are reimbursed, how we do analysis on those codes, how we understand those codes, because again, all of this is going to tie into what kind of data we're extracting, how we're using it, how we're modeling it, and how we basically can do good, good data and analytics with that information. These are key fundamental data analytics to know in the healthcare field, and some business and economics behind it. And if any of this doesn't make sense, that's okay, because we will be going in much detail about what all of these things are in the bootcamp. From there, we're going to build on. So now you're going to have the basic understanding of sort of the landscape, how that money works, and how we pluck that out of our data and use it, how we actually get our hands in there and extract some of this data and work with it. And now we're going to talk a little bit about what do we do with it. So we're going to get more into some of the use cases, I might call, which is like population health analytics, quality analytics. We're going to get really deep into the weeds about what these quality measures are, where they come from. You hear this. This is a very important concept in this line of work. We're going to work our way through some of these quality measures and some of the specifications. We're going to look at against the data and all that we've been working with to understand it. We're going to design some dashboards of basically performance improvement types of projects, and really customize our lab for how do we use all of this stuff that we've learned in various different use cases that are very important to the healthcare system here. And we'll pivot a little bit. We'll start talking about health equity, or in the context of digital health equity and social determinants of health. This is really important right now. Many of you have probably heard of these topics. We're going to take a little bit of a different spin on it. Of course, we'll talk about what it is and how we make sure that the data and the analytics that we're doing is fair and transparent and equitable, and we draw conclusions that don't marginalize vulnerable communities and stuff like that. But we're also going to be having a learning lab on actually exchanging and extracting specific social determinant of health data from an EHR record, and working with it to draw some conclusions and to do some analysis. And so that'll be part of one of our hands-on learning lab as well. And we're going to spend a little bit of time on privacy and compliance. We'll talk a little bit about ethics, and especially in the onset of AI right now, what that means in healthcare. We'll talk about HIPAA. This is probably not one of the more fun topics, but it is one of the more important topics, and it is one of the content areas on the HIMSS-CAHIMS certification exam if you're planning to take that. So we will cover at a high level, because this could be an entire class on itself, some of the key compliance and healthcare privacy policies, such as HIPAA and 42 CFR and things like that, things that govern our field and how we exchange data, who we can share it with, what we can see, what we can't see, as well as some of the national health data privacy and policy procedure acts like TEFCA and Cures Act and data blocking and stuff like that influences, again, how we can use this data, who can share it, who can see it, and how we think about ethics with data. And then in the last week, it'll be a little bit more of some of the softer skills. We'll focus a little bit, we'll kind of pivot away from some of this technical and really in the weeds stuff. And we'll talk a little bit more about collaboration with other different types of stakeholders, especially because folks who are working in a field like this, health tech or digital health or health technology, health IT, have to interface a lot with clinicians and with business stakeholders in the healthcare system. A lot of times, the roles that we're preparing folks in this program for are the ones who are going to be, helping to either evaluate or implement new data apps or digital health apps. So we'll talk about like requirements and how do we kind of evaluate some of this stuff. So it's a little bit of a softer way to kind of end and kind of wrap up with a bow all of the stuff that we've talked about throughout the course. This kind of just sums up everything that I said, but just these are kind of the core competencies, and all of this is really aligned and designed around this HIMSS-CAHIMS exam, which I'll talk about on the next slide a little bit. But interoperability, so that's all the FHIR, the standards, the HL7 messaging and all of that, those standards. The systems, EHRs, SDOH, exchange platforms, digital health tools, our industry concepts and our industry standards. Those are like our code sets, all of our standard quality measures and stuff like that, and our professional skills and our hands-on tooling with our sandbox and all of our learning lab activities. So from all of that, I think, again, this is kind of a wide and it's a very high-level intro to some of this stuff. A lot of this stuff you can dive much, much deeper in subsequent learning and in classes and stuff like that. But we have aligned these core competencies specifically around this HIMSS-CAHIMS certification that I mentioned. So you can look that certification exam up. Many of you may have heard of the HIMSS National Conference. It's one of the largest annual healthcare technology conferences next to Health, HLTH, in the nation. They also have these certification credentials, of which CAHIMS is one. It's like the entry level one. There's some further ones along, and it's for health technology professionals, basically. CNM may have some funding as well to cover the costs for that exam. So if you're interested, definitely let me know so we can kind of know up front. But yeah, you can look that up, and there's training guides and study guides and all kinds of good stuff for that. So if that's something that you're interested in pursuing, definitely let me know as we get kicked off. Another thing that we're going to be doing at the end of this program is matchmaking. I have here internship. There could also be some position matchmaking and things like that, but I've been working and my colleagues been working in the New Mexico healthcare ecosystem for many years, and so we have some health tech startups who are interested. We have some healthcare organizations who are interested. And what we're going to be trying to do is try to do some matchmaking between what our students' interests are, where they want to go. Can we create some pathways for them? Can we get some projects, that they can work on for their portfolios, just depending on what everyone's goals are? How can we set you up and get you hooked into the ecosystem? I would love if we could get some folks hired or some internships created that were in specific areas. Just for me, it'd be helpful to know kind of where everybody wants to end up, and I can start thinking about that stuff early. But that'll be part of it as well as we finish up the program. And then just down here on the bottom right, these are just kind of examples. Again, this is a very broad, high-level overview of a lot of concepts that are important in a lot of different areas. So these are the types of roles that this can help to prepare you for, but these also come by many other different names. And so what I'd really love to do as well is if you all are looking at this as a career, your next step, like let's all, I'll probably meet with everybody one-on-one just to get to know your goals and kind of what you're hoping to do, and making sure we can tailor all the learning, but also just making sure that we can kind of set you up for success from the beginning, and I can help connect you and help you think about what other types of roles maybe you want to look for and all of that. But these are just some examples of what kinds of stuff this can prepare us for. And again, just to kind of summarize it up, and I'll be posting this online and sharing it with everybody. But again, our application deadline is January 16th to get all set up. We'll be kicking off on Monday, January 26th. We have grant funding for our program and scholarship, and you can learn more here, scan this Q card and apply. And Devana is our amazing contact for all of that. So any questions about onboarding, funding, the actual administrative process of getting going and getting all set up with CNM, I'll have to defer to her, but she had to jump off for a call. She'll be back at 12:50 if we're still on. But yeah, so that's kind of our very quick fly over, and I know that was a lot of information, but I will stop there. What questions do y'all have for me? Let's see here. Will the sessions be recorded in class? Yes, they will. Sessions will be recorded in case you miss a class.
Thanks, Stephanie. That was a good overview. I was wondering, for the sandbox stuff and some of the working sessions, are we going to have some freedom on topics of what we focus on in those, creating FHIR for ECRs versus ELRs, or certain conditions, certain determinants of health, stuff like that, or is it how does that?
That's actually a really great question. I would love if we do have some flexibility. Let me check. So I actually have some partners coming in to teach that part specifically. I'm focused a little bit more on the health econ and the claims analytics. For that part, yes, definitely. What I want to do is give basically a dummy data set that you guys can kind of take a area of interest or something of interest and do some analysis with it. But for that one specifically, I'm not sure if they have it set up, prescribed, but I'll find out and let you know.
Thank you.
Have you worked with any of that stuff before, Graham?
Yeah, I mainly work with ELRs right now, HL7 2.5, but I do work a little bit with our ECR coordinator, and we just did a FHIR project with respiratory conditions. And so yeah, I'd be interested more on that side versus the ELR side. But yeah, I definitely am open to other stuff too, for sure.
Okay, yeah, let's see if I can get some details on the use cases or the example. And also like I think they open that up to the learners as well. So, and I think it has a lot of example data and stuff in there. So I think there's also sort of a playground sort of aspect that maybe even if we don't do that in the lab specifically, because it's more of a walkthrough activity, perhaps there's more opportunity to just kind of get in there and play around with stuff as you see fit. But I'll definitely double check.
Okay. Yeah, I was also interested in like smart on fire applications that are directly kind of used by providers and EMR vendors as well.
Okay, great. Let's see here. Farnad says, what software will be required in preparation? Oh, I think I mentioned this right before you hopped on, Farnad. So just a basic understanding of like a comfort and familiarity with like data, probably to like an Excel level is okay, and a comfort and familiarity with using new software tools and technology. And I'm keeping that very broadly because we have, you'll see this in the documentation that I send out afterwards, but the tools and technology that we're using for the sandbox are like very specific, kind of esoteric types software tools that they're using for the stuff that Graham was talking about. So no, you don't need to know explicitly any one software, but I'd say a comfort with learning in new technologies and working with data and stuff would be very helpful. Sure.
One more question. Is there going to be any topics or any relationship to like HIEs or other, health ecosystem organizations that may not be directly provider or clinical based?
Yes, we'll definitely talk about the HIEs and actually do a lot of work with our state HIE as well, if that's an area of interest. How kind of all of this comes together in HIE and how that is used or could be used, I would say, for some of the stuff that we're talking about for sure.
I have no specific question right now, although after this info session, I'm very, very interested. All this information seems almost essential for what I was working on during graduate school. We use a lot of the healthcare data, but not understanding maybe how it's handled or how we can handle it if we want to input it into like a machine learning or an AI algorithm. What is the best method so we don't bias data incorrectly? I think a lot of this information will help clarify best way to handle that kind of data before inputting it into something that will generalize everybody.
Oh yeah, absolutely. I was like, even just in the analysis process and the data transformation process, there can be a lot of bias introduced. We as analysts can introduce bias unintentionally. So I'll definitely make sure we weave some of that in for sure.
Yeah, just interested in delving more into these. I worked on the ResMed on FHIR, a pilot with CDC. And so there's just a big push for a lot of automation for, collecting the data. And yeah, I just want to make sure that we're doing it right. And also I see with a lot of this automation actually protecting privacy, where you don't have, people don't have to be looking at charts. It can be automated and you can still have patient level data, but it's completely anonymized. And so that's kind of what I'm looking at, is like how to use the data, but keep, the privacy part. Really
Okay, got it. Okay, that's very helpful. Let's see, Lady says, not sure what you'd be interested in. Don't know about these topics yet. That's okay. But love working with data, care about equity, especially to Spanish languages. Oh, biology background. Okay, interesting. We could talk, and maybe if you think if I'll send this recording out, I think you might have joined a little bit late too, but if you think of any questions or if you want to chat one-on-one to kind of dive into this a little bit more exploratorily, I'm happy to hop on a call with you as well. There's a lot of areas that I think that there's a application for what you're saying, especially in, I don't know if you were on when I was starting to talk about like digital health applications and digital health equity. There's a lot of push around developing kind of what they're calling, I don't know if I love the term, but like culturally competent methods and applications and interventions and stuff like that that can really help populations and communities that maybe haven't been as well served by the healthcare system. And this is a big area of focus for them. Yep. Yeah, email me if you want to chat more one-on-one about that. Awesome. Okay. All right, folks. Well, let me pop in my email address into the chat in case you want to email me one-on-one. Again, I'm happy to meet with anybody if you want to talk, more privately, or we want to get a little bit more exploratory about any of this stuff or dig deeper. I know some of you are formally registered. Some of you still have some outstanding bits, so I'll get with Devana about reaching out and just making sure everybody's good to go. Hopefully this answered any questions that you have, and I would certainly love to have all of you in January. And one of my goals will be, even if everyone's coming from different levels of expertise and understanding, I think that can actually really enrich our experience and learn from each other. So I'm going to do my best to really try to tailor this to where everyone's at without, glossing over too much and going too deep in the weeds on other stuff if we don't need to. So really flexible to what we want to get out of this. Folks, all right, well, I think we are good then. Email me if you have any questions. We'll talk soon.